Hello. Okay. The Health Subcommittee of Health and Education will come to order. We need to take roll.
Senator Sasslaw? Senator Barker? Senator Donovan? Senator Suderline? Senator Lewis?
Here.
Mr. Chair, we have a quorum.
All right, good enough. I do not know where Senator Peake is first up, and he's got our two heaviest lift bills. And we've got two patrons here. Oh, I'm sorry. Whoops, Senator Boysko as well. Okay. Who's got the lowest bill number? All right. That's right. Manners born, manner bred. All right. Senator Boysko, everybody's deferred to you. What's your bill number? Tell us what it does. Turn your mic on.
Thank you so much, Mr. Chairman. My bill number is SB 1227, and it has an amendment in the nature of a substitute before we get started.
You have a substitute? Is it up online, do you know?
I think that DLS should have it. I was corresponding with them earlier today.
All right, let's check and see.
Mr. Chair.
Is it up?
You guys can see me, but we just uploaded the substitute to LIS, so it should be there momentarily.
Okay, great. Let's get the substitute in front of us. Do we have a motion on the substitute? Okay. Senator Barker moves and Senator Suderline seconds, so we've got the substitute in front of us. Tell us what the substitute does, Senator Boysko.
Yes, so the bill is on expanding access to birth control for 12 months for our Medicaid and FAMAS recipients. This substitute basically puts the language more closely with the funding that the governor has in his budget, and it was suggested by the Department of Medical Assistance Services, conforming it basically so that it was more in line with it.
Okay. All right, any questions from the subcommittee for Senator Boysko? Questions for Senator Boysko? Shout out if you got them. We'll go to see if is there anybody queued up to speak on Senate Bill 1227.
Mr. Chairman, I have some people who do want to speak. I have the Department of Medical Assistance Services on the line, as well as representatives from Planned Parenthood in Narell, Virginia.
Okay, how many people, Madam Clerk, how many people do we have signed up in the queue?
We have 3 members of the public raising their hands.
Okay, that's fine. So we don't need to worry too much about time then. All right, go ahead. We'll accept public comment.
Julia Carlton, please go ahead.
Julia Carlton's a DLS attorney, so might want to move on to the next person.
Ray Pickett, please go ahead.
Good afternoon. My name is Ray Pickett. I'm Interim Executive Director of Planned Parenthood Advocates of Virginia. We enthusiastically support this bill because access to a 12-month supply of birth control helps people avoid unplanned pregnancy. 77% of Americans believe that Medicaid should cover birth control. Having coverage of a 12-month supply of birth control eases so many barriers that make it harder for people with low income to access contraception. Barriers to reproductive health care are significantly increased for a woman during the pandemic, making coverage of an extended supply of contraception more crucial than ever. Planned Parenthood stands in enthusiastic support of Senate Bill 1227. Thank you.
Okay, next.
Chetham Baketti, please go ahead.
Hi, yes, thank you so much. Can you hear me okay?
We've got you.
I
go
think
ahead.
that is a yes. My name is Chetham Baketti. I'm the Chief Medical Officer at the Department of Medical Assistance Services. Thank you so much for giving me the opportunity to speak. On behalf of Department of Medical Assistance Service, I want to say that we strongly support this bill, SB 1227, for the reasons actually stated by the prior speaker. I'm here if anybody has any questions or if I can provide any technical assistance.
All right, next.
Jelena Verchena, please go ahead.
Hi, good evening. My name is Galina Verchena, and I'm the Policy Director for Narrow Approaches for all of my comments with what Ray Pickett has said from Planned Parenthood. Most importantly, I suppose, is that this bill brings people who are on Medicaid into parity with people who receive their insurance through the private market. This legislative assembly has already made that change in 2017 for those who get their insurance through the private market. So it is time for us to bring those who are on Medicaid to have the same standard as those who are not when it comes to receiving birth control for the full 12 months. Thank you.
All right, thank you. Is that it for the public comment? Is that all we've got?
We have one more member of the public raising their hand.
I'm
sir.
sorry. Go ahead.
Armani Anderson.
Hello, my name is Armani Anderson, and I'm a third-year student at the University of Virginia. I live in the 25th District. Thank you for allowing me to share my story in support of Senate Bill 1227 with you. I severed ties with my parents halfway through my first semester of college, leaving me to navigate the complicated world of healthcare completely on my own without insurance coverage, comprehensive information, or adequate support. My experience with birth control has and continues to be a struggle. Without having access to my family history, I experienced many initial health complications once on the pill. I had to find friends to drive me to the doctor and the pharmacy because I didn't have reliable transportation. I also had to pay out of pocket for my birth control, which as a college student wasn't easy. Faced with these financial and logistical barriers, I knew I needed healthcare that would help me pay for the medication I needed. After lots of time,
We're having a little trouble hearing. Can we, I don't know if it's on your end or our end, Ms. Anderson.
I'm sorry, can you hear me now?
Yeah, that's better.
Okay. Faced with these financial and logistical barriers, I knew that I needed healthcare that would help me pay for the medication I needed. After lots of time and energy, I was able to acquire Medicaid. I shouldn't be denied the same kind of healthcare access my peers have just because I use Medicaid. Virginia Medicaid recipients like myself are equally worthy and deserving of the same kind of healthcare access, no matter what insurance plan we may use. I know firsthand that reproductive freedom isn't just about having the right to decide what happens to our bodies. It's about being able to access equitable healthcare once those decisions are made. I'm testifying because I understand the institutional barriers to healthcare and coverage that have harmed so many generations of women, including that of my own and those before me. I understand that being forced into a single option because it's the only thing someone can afford is not the same as having an autonomous choice. I urge you to please vote in support of Senate Bill 1227. Thank you.
Thank you, Ms. Anderson, for taking the time to share your story with us. Okay, we've got Senate Bill 1227 in front of us. Is there any discussion on Senator Voisko's 1227? All right, we operate by motion.
So did we adopt the amendment, sir? I'm sorry. Was it?
I thought we did. Yeah, we did. Yes. All right, so Senator Sasslaw has moved that we report. Is there a second? It's been moved and seconded that we recommend reporting Senate Bill 1227. All in favor? I assume, are we recording these votes? How are you guys doing this?
We can take a voice vote if you'd like, sir.
All right.
Senator
All in favor? Oh, go ahead. Yeah, go ahead.
Senator Sasslaw? Senator Barker? Senator Donovan? Senator Suderline? Excuse me, sir? Yes, sir. And Chair Lewis?
Yes.
5 ayes, 0 nays.
All right.
Thank you, Mr. Chair.
Has anybody heard from Senator Peake? Oh, there he is. You snuck in on me. All right, we're going to go back. You're first on the docket, so we're going to go back and, sorry, guys. Oh, Mark's going to be quick. I'm only giving 15 minutes to each side. How long is yours? All right, he was here first. No, he's not. All right, Senator Peake, we're going to go out of line. They've got really quick ones. Senator McPike, what's your bill number? Tell us what it does.
Thank you, Mr. Chairman. Senate Bill 1302. What this bill sets out to do is actually align the Marcus Alert bill that we set out in special session and the call crisis center that's also contemplated as part of STEP Virginia. Furthermore, it aligns the rule from the FCC of July 16th of 2020 regarding the nationwide 988 number, which is the National Suicide Prevention Line. So what this does is marry the call crisis center as well as the National 988 line that is designated to start by 2022, and it designates additional wireless cell phone 911 fee designated for the 988 line, Mr. Chairman. So there's some additional cents, brings up the tax rate to 94 cents of the wireless E911 surcharge, which covers the cost of that program.
And Senator McPike, when was the last time that was adjusted?
Yes, Mr. Chairman. The last time, as I understand it, researching with tax, the last time the 911 wireless fee was changed was roughly 20 years ago. And so this begins to take a look and address some of the improvements to the service that we do, in addition to the next-gen 911 and texted 911 service needs of the 911 board as well.
Any questions of Senator McPike on 1302? Got any questions? Is there anyone signed up for public comment?
No, Mr. Chairman.
No public comment, no questions. All right, we operate by motion, in which case I'll move to report, and Senator Barker will second that we recommend reporting Senate Bill 1302. All right, call the roll.
Senator Saslow? Senator Barker? Senator Donovan? Senator Suderline? Senator Lewis?
Aye.
Ayes 5, no 0.
All right.
Thank you, Mr. Chairman.
Yes, sir, Senator McPike. Senator Stanley, what's your bill number and tell us what it does?
Thank you, Mr. Chairman, members of the committee. My bill is Senate Bill 1416, and I thought you, Mr. Chairman, already knew what it did, so that's why you said it was really quick.
Studying it extensively. Yeah.
Based on that representation, Mr. Chairman, I think I can do this in just a couple seconds. This is a bill that this subcommittee may have seen before it, Mr. Chairman, but certainly the whole Ed and Health Committee saw it, and it also passed out of there and then onto the floor of the Senate, where it passed unanimously with the clause 40-0. In a measure, in the easiest way to describe it, Senate Bill 1460 basically amends the state plan for medical assistance services to require payments for medical assistance for remote patient monitoring services for rural and underserved medical populations, with the home as an eligible telemedicine origination site. What this bill does is it requires DMAS to prepare and submit to the Centers for Medicare and Medicaid Services applications for the waivers necessary to receive payments for remote patient monitoring services in those rural and underserved areas, and especially where it's so far, Mr. Chairman, for some of our people who really need this kind of monitoring service to travel 90 miles, 120 miles, allowing remote patient monitoring at the home and to be covered by Medicaid or Medicare would be an incredible boost to rural healthcare and healthcare in our underserved and underprivileged areas. And that's the bill, sir.
All right, good bill. Any questions for Senator Stanley on Senate Bill 1416? Oh, Senator Barker.
Thank you, Mr. Chair. Actually, I have a bill that is broader than what Senator Stanley has.
Mine is better.
Always. So what I would do is to, we could pass both bills, and then we'll work to make sure we get the language compatible.
Senator Barker, what's the status of your bill? Where is your bill in this subcommittee, or?
Yes, it is.
Have we got it on today's docket?
Yes. 1338.
Okay.
Mr. Chairman, Mr. Chairman, back in the day when we were in the majority, in order to make sure.
When was that? I've heard
it
tell of that.
It was
that
Stone Age times, but
Okay.
I worked with George Barker to make sure that he'd have his name on some legislation, and I enjoyed it so much. I'd love to work with him, and however we can work to get this very important issue across the finish line, I'm happy to do.
Senator Barker, is your bill sufficiently similar that it does not need additional explanation, and we can take action to kind of roll them in now, or do you want to?
Mine is broader, because mine is comprehensive, so his is just for rural areas, that type of thing, as I understand the bill there. But we also go beyond just the remote patient monitoring service, but to define for purposes of reimbursement with DMAS, Medicaid, the telemedicine services generally and medically necessary in terms of getting those definitions in the code, so that there's DMAS can then make sure that they're providing reimbursement in all situations where it's necessary.
All right. Why don't we do this really quickly then? Why don't you address Senate Bill 1338 so we can take action and consolidate these bills, or recommend that to the committee? And
actually, I have a substitute or amendment.
It gets better. Okay. All right. Let's turn our attention then to Senate Bill 1338, Senator Barker, and since it's going to deal with Senator Stanley's bill, and he has a substitute, so let's go ahead and move. Senator Donovan moves, and Senator Suderline seconds the substitute. So we have the substitute in front of us. Senator Barker, go.
All right. What you have is a substitute in front, and I don't have the substitute here because we just got that substitute done today. But basically, what it does is it's very straightforward, and it provides something that will help DMAS in being able to make sure. So the only thing there, so it does deal with one of the times and period. One of the justifications for having the telehealth thing would be patients at risk for hospitalization to be covered there. So we have that, and what we do is we do this remote patient monitoring. It is a visual thing. It's not just simply picking up a telephone line and talking with a patient. And it does standardize some of the identification that's been done in other settings within the code to make them applicable to Medicaid's reimbursement rates. Medicaid reimburse what they are reimbursing for. So it's basically anything that's medically necessary, where the remote patient monitoring is a service that is justified, and the telemedicine services are designed to be a visual type of service that's provided there.
Okay. Any questions from the subcommittee for Senator Barker on 1338? Questions on 1338? All right, so I think the motion would be that we recommend to the full committee rolling Senator Stanley's 1416 into Senator Barker's 1338, and recommend reporting the combined bill, if that makes sense. Yes, Senator Donovan.
Not to belabor the point, but I can't emphasize how important this is. So many times doctors cannot assess in a phone call whether or not a patient's okay, and they go to the emergency room and they maybe get admitted, and that's not what they needed. They would have been better off at home in the first place. And so this at-home monitoring that's virtual, that's telemedicine, and you can see the patient's huge. And it's a really important step to improving outcomes for patients and reducing the cost of health care.
Great. That's why it's great to have a doctor on the health subcommittee. I see Scott Johnson in the queue there. Scott, want to comment on this bill?
Yes, sir, Mr. Chairman. Scott Johnson, General Counsel for the Medical Society. I want to thank Senator Barker and Senator Stanley. Very important issue. We support the substitute that you just adopted. Okay. Thank you.
And anybody else on there for public comment? It seems like the train's leaving the station, so if you've got anything to say, just...
Kathy Wibberly.
Good afternoon, and thank you. My name is Kathy Wibberly, and I am Vice President of the Virginia Telehealth Network Board. I also work at the University of Virginia Center for Telehealth. The Virginia Telehealth Network strongly supports reimbursement for remote patient monitoring, and we want to thank both Senator Stanley and Senator Barker for introducing legislation to move this forward in the Commonwealth.
All right, great. Anybody else really quickly? Okay, that's good. All right, so let's see. Who's going to make the motion? Senator Donovan, you want to make the motion? All right, and Senator Saslaw will second that we recommend to the full committee rolling Senator Stanley's more narrow bill into Senator Barker's more broad 1338 and recommend reporting the combined bill. Call the roll. Yeah, sure.
Senator Saslaw? Senator Barker?
Aye.
Senator Donovan? Senator Suderline? Chair Lewis?
Aye.
5 ayes, 0 noes.
Okay, great. And just a bit of housekeeping, I notice as I'm going on the docket, I have Senate Bill 1362, and that is somewhat of a work in progress with some stakeholders, and so without objection, that's going to go by for the week. All right, and now we have Senator Locke, who I apologize to, did not see her on the docket until just now, and she's got Senate Bill 1121. Senator Locke.
Thank you, Mr. Chairman. Senate Bill 1121 addresses amending birth certificates, and the issue has to do with, can you all hear me?
Yes, we've got you.
Oh,
we got
okay.
you.
Real ID laws require individuals to use their birth certificates in order to obtain a real ID. Once real ID laws go into effect, individuals will be unable to fly without this ID or a passport, which also requires a birth certificate. Many individuals do not realize that there is incorrect information on their birth certificate until they go to obtain their real ID, and the process to correct their birth certificate creates a barrier for low-income and older adults. This issue is of particular impact to low-income older adults who have birth certificates that are handwritten or illegible due to home births and poor record keeping. Individuals should be able to appeal to Vital Records through a simplified process to correct those issues when they have credible evidence of the error. The vast majority of states have already have a process that includes online materials for the public to use to request the needed changes. So what SB 1121 does is to clarify that all applicants should be evaluated through an administrative process and only be referred to court if Vital Records is unable to make a change. It allows applicants whose change is not to be given written notice if Vital Records decision on their application for a change, which advises of their right to petition in court, and finally mandates the amendment process be easily accessible online so that individuals can fill out and submit forms without having to call into the Vital Records office. So SB 1121 will make access to travel easier for low-income and older adults by eliminating administrative and procedural hurdles that require low-income people to go to court unnecessarily. And Mr. Chairman, I failed to mention that there is an amendment in the nature of a substitute for this bill.
Okay. Senator Barker moves and Senator Saslaw seconds the substitute. All in favor? Aye. Substitute's in front of us. And so were you, Senator Locke, you were speaking?
I was speaking to the substitute.
To the substitute.
Yes.
Okay, great. Any questions for Senator Locke on 1121 from the subcommittee? Any questions? Do we have public comment? Have you got a question, Senator Donovan?
I'm just curious, Mr. Chairman. I don't have the substitute left, and I was reading and read along as she was speaking on the original bill. What's the difference in the substitute?
Senator Locke?
I think there was just a clarification, a technical change in clarification.
Thank you.
Nothing substantive?
No.
Okay. Is there anybody signed up for public comment?
Yes, sir, Mr. Chairman.
All right, let's go.
Natalie Snyder, please go ahead.
Good afternoon, Chairman and members of the committee. I'm Natalie Snyder. I'm the State Advocacy Director for AARP Virginia, and I would like to say that we support this bill, SB 1121. Our policy says that we need to remove burdensome and onerous administrative processes and minimize costs to states and individuals. And we believe that this bill does that by making it so that people don't necessarily have to go to court to have these changes made. So we just want to express our support for the bill. Thank you.
All right, yes, ma'am. Thank you. Anybody else?
Emily Hardy.
Hardy?
Hi, good afternoon. My name is Emily Hardy, and I'm the elder law attorney with the Virginia Poverty Law Center. To answer the senator's question, the substitute we worked on with Vital Records to make sure that it aligned with them and that they were able to address their concerns. So that was primarily the substitute, just simplified the language and made it more clear for Vital Records so that they could implement it. I run a statewide legal helpline, which answers calls from people all over the Commonwealth. We've seen an increase in problems with the birth certificates due to the Real ID laws and an issue calling in and being told to refer to court, referring people to court. So this, as Senator Locke stated, this bill simply makes it so that the process needs to be followed administratively first, that people are given proper notice of what they need to do and aren't just referred to court over the phone, and that the information is online so that people can access it and request the amendments easily. We thank Senator Locke for bringing the bill, and we hope that you support it. Thank you.
Josh Hetzler.
Mr. Chairman, Josh Hetzler with the Family Foundation. We think this piece of legislation unfortunately gives over to unelected regulatory bodies something that's very fundamental that we think ought to reside in the legislature, things such as what would be required to change very basic things on a birth certificate. I also see that this would take away the requirement that somebody get a court order to change their sex on their birth certificate. We think that this could lead to fraud in ways that would be very unhelpful and unfortunate. And so I think it would really be best when we're talking about fundamental issues such as this, that it really reside in the hands of the legislature instead of handing it over to folks that may have good judgment, may not, but we don't know what regulations they might pass pursuant to this. So those are our concerns. Thank you for hearing us out.
Yes, sir. Thank you.
There are no more speakers in the queue, sir.
Are there any questions as a result of the public comment from the subcommittee? Any questions? All right. We have a substitute in front of us. All right. And got a motion and a second to recommend reporting the substitute to Senator Locke's SB 1121. I'll call the roll.
Senator Saslaw, Senator Barker, Senator Donovan, Senator Suderline, yes, sir. Senator Lewis?
Aye.
4 ayes, 1 no.
All right. And Senator Peake, we've got Senator Edwards here, and I think his is probably going to be a lot quicker than yours, so I'm going to go right to him too. Senator Edwards, got SB 1421. No, you got to turn your mic on. Turn on your screen. It's on your screen, John.
All right, thanks. This Senate Bill 1421 is a very simple bill. It relates to the definition of brain injury. Currently, the definition in Section 37.2-403 of the Code of Virginia says, quote, brain injury it means any injury to the brain that occurs after birth, quote, but before age 65, end quote, that is acquired through traumatic or non-traumatic insults. Now, what we want to do is take out in the definition, take out the language, but before age 65. The reason that was in there originally is because they were thinking at that time we might get a Medicaid waiver with regard to brain injuries before age 65. Let me see. Yeah, but that never actually happened. And so we know people over 65 get brain injuries as well. A lot of falls occur causing brain injuries to people who are over 65 on a regular basis. So the definition, which was created years ago, no longer applies. And so what we want to do is take out that before 65 component of what is a brain injury. And I understand the agencies are in favor of this. The Department of Aging and Rehabilitative Services, which is the lead agency for brain injury related services in Virginia, is supportive of this effort. And this bill was brought to me by Becky Bowers Lanier. I don't know if she's here or not, and maybe Ann McDonald with the executive director of the Department of Aging and Rehabilitative Services. I believe that's her title. Are either of those here? Becky Bowers Lanier?
Ann McDonald is here, sir.
Ann McDonald, okay. Ann McDonald, thank you for being here. Go ahead. Yeah, would you like to speak in favor of the bill?
Yes, thank you. This is Ann McDonald. I'm the Executive Director of the Brain Injury Association of Virginia, not the Executive Director of DARS, but appreciate the promotion. This bill was brought to Senator Edwards on our behalf. This is language that appears in the licensing section of code for the Department of Behavioral Health that related to group homes. So we are supportive of the bill, and thank you for hearing our testimony.
Thank you. Is there anybody else signed up to speak for public comment?
Yes, sir. We have Colleen Miller.
Okay, go ahead.
Good morning, Mr. Chair. Colleen Miller, or good afternoon, I guess it is now. Colleen Miller, Director of the Disability Law Center of Virginia. Just asking to speak in support of the bill. We do think this is a very important measure, and thank Senator Edwards for bringing it.
So let me ask you, so the genesis of this language was the anticipation of a waiver, Senator Edwards said?
I believe that was the genesis of why the limitation was put.
Yeah, that's what I meant. Yeah.
Yes, yes.
Okay. Any other public comment? Is that it?
Sir.
Okay.
Oh, I think.
Senator Edwards, you've got anything else?
That's all. It's about as simple a bill as you can get.
It's pretty simple. All right, we operate on motion. Senator Barker moves to report, and Senator Sasslaw seconds that SB 1421 be recommended to the committee to be reported. Call the roll.
Senator Sasslaw. Senator Barker. Senator Donovan. Senator Suderline. Senator Lewis.
Aye.
5 ayes, 0 nays.
All right. Thank you, Senator Edwards. Senator Peake, you are at last up. I'm sure.
Well, if you're sure, I'm here. I'm ready.
Senator Peake, let me ask you administratively on these two bills. For public comment, can we combine public comment on them?
Yes, sir.
My thought is I'm going to give proponents 15 minutes and opponents 15 minutes. So
I think that's wise. I think they're very similar bills. I think that makes perfect sense.
Okay. All right. Well, go ahead.
Thank you, Mr. Chairman and members of the committee. Senate Bills 116 and 117 are like First Amendment religious freedom bills. 117 is a little broader than 116. They both accomplish the same purpose in that the current code allows for the declaration of a pandemic or an emergency situation, and it does not allow for parents to have a religious excuse for vaccinations for their children. And my bill would allow for religious exemptions for vaccinations even during a declared state of emergency or a pandemic such as what we're in now. And that's what this bill does. It covers the current coronavirus pandemic, but it also covers anything that may come down the road. It simply provides for our First Amendment protections.
Okay. So that's 117. And how about 116?
Same thing, Mr. Chairman. 116, it really just has one line where it says the commissioner has the power to do it except for, and it had, under 116, the commissioner could do it even if there was a state of an emergency declared. We struck that in 116. And then 117 is a little tighter and broader, and it strikes it in some other areas. So there's not much difference. 117 is probably the better bill, but it removes from the commissioner the power to mandate that everyone, even in a pandemic or declared state of emergency, get vaccinated if there are religious objections.
All right. So that's the bill. So what we're going to do, I know we have a number of people who are interested, obviously, in the subject matter. So what we're going to do is start with proponents. We're going to do a 15-minute timer, and that's 15 minutes for the whole group of proponents, 15 minutes for opponents, so half-hour total. And so you all, if you're proponents, you're going to have to be aware and cognizant of the fact that the time you take is taking it from somebody else. So just be aware of that as you speak, and be brief and to the point. All right, let's start with the proponents.
Marcia Lessard, go ahead, please.
And let me at the outset, let me make clear, in case you didn't hear the discussion between Senator Peake and myself, the public comment is going to be in regard to both bills. So we're going to be taking only one set of public comment, but it's going to be, you can speak to both bills, you can speak to one bill, you can do whatever, but we're not going to have two sets of public comment on the two bills. Okay, go ahead.
Marcia Lessard, please go ahead.
Hi, thank you. I'm so grateful to have a few minutes to talk. I'm here today to talk about equity with this bill. I represent Virginia Freedom Keepers. We have a petition going with thousands of signatures on it already to support this. Equity and equality is a huge concern of ours as we're a nonpartisan organization. And if this bill doesn't stand, we have members of the community who said that they would happily leave this state and move elsewhere. Now, this creates a huge inequity and inequality for members of our constituents who are of the low income status and won't be able to leave if this were to come about. And if they had a strong, religious stance that would prevent them from vaccinating, they would be coerced to do so in order to have education for their children. We believe this provides a massive inequity for our children in the state. So we firmly support these bills and hope that you will as well. Thank you so much.
Can I ask a quick question? What would
Yes,
be the basis of the religious objection? I mean, what would be the religious piece?
Right.
Where's the religion fit?
There's a lot of reasons why across the board. They're not, and oftentimes the way that they're cultured, the ingredients in are not kosher. They don't meet the standards because they have animal particles that are involved in the culturing, don't meet the standards of the Muslim faith. There's a Christian component to it with some lines coming from aborted fetal cell lines. And then there's also a concern about the adjuvants across the board and what those do to the structure of a person cellularly. So there's a multi-faith aspect to this one, sir.
Okay, thank you. Next up.
Patricia Powers.
Thank you very much, Mr. Chairman. I'm a pediatrician, a pediatric endocrinologist, and I own a small practice in Central Virginia. This country is founded on the concept that our rights are endowed by God. And these allow equal protection under the law, regardless of race or creed. Now, the whole concept of what religion is there's not a standard definition, but it does imply this constellation of behaviors, practices, moral views, worldviews, that relates humanity to the supernatural. But even Wikipedia says that there's no scholarly consensus over what precisely constitutes a religion. So it's broad. And like Marcia said, the religious exemptions can involve a problem with using aborted fetal tissue to either develop vaccine products or test vaccine products And there's a number of cell lines that are derived from fetal tissue that you can look up that meet these criteria. There are some people of faith who specifically prefer to rely on prayer and not on medical therapeutics for healing. And then in my case, I'm a Christian, and my faith teaches me that I am responsible for taking care of this body, which is the temple of the Holy Spirit. And I'm responsible for stewarding what goes in and what stays out. And so I have an issue with some of these adjuvants, like Marcia mentioned. I have an issue using products that could be derived from aborted fetal cell tissue lines and products thereof. So I appreciate you hearing me, and I strongly support these bills and the restoration of a religious exemption for immunization practices.
All right, thank you. Next up.
Elizabeth Mumper.
Thank you. I'm a board certified pediatrician with 40 years of experience practicing pediatrics in Virginia. I also have some extra expertise in vaccine science, and I've served on the National Vaccine Compensation Program as an expert witness. I strongly support Senator Peake's two bills. I have a number of patients in my practice that sincerely believe that it is not right to inject toxins and adjuvants or fetal tissue parts into their babies. I would hate to see those same wonderful parents be charged with class 1 misdemeanors during the declaration of an epidemic or pandemic. Studies in my practice, and actually have been replicated in 2 other states now, show that children who are vaccinated on a modified schedule or under-vaccinated compared to the CDC schedule are actually healthier with less chronic illness. And I have a great deal of concern about aluminum in particular, which is in a lot of vaccines, and cumulative toxicity for that can have terrible neurodevelopmental outcomes. If we use an active surveillance system, about 1 in 39 vaccines results in a significant adverse reaction. And if we look at the MMRV vaccine, it's actually 1 in 26. So neither getting a vaccine nor foregoing or delaying a vaccine is risk-free. And I think that the parents who have these strongly held religious beliefs should be able to make that decision. And I want Thomas Jefferson to feel proud that we've carried on the legacy of religious freedom. Thank you so much.
Yes, ma'am. Thank you. Next.
Jason Garwood, please go ahead.
Are you there? Hello? All right, we're having some issues hearing you. Can you do it? Can you do anything on your end to improve your connection? All right, we're going to have to skip over him and go to somebody else.
All right, Jason, we'll come back to you. Josh Hetzler, please go ahead.
Chairman Josh Hetzler with the Family Foundation. Thankfully, Virginia has long held a religious exemption for parents when it comes to mandatory vaccinations. And as I understand it, a very, very small percentage of Virginians actually take advantage of that. I believe that Virginia may be number 1 as far as the percentage of children who do get vaccinated, who are the highest on getting all of their vaccinations. So, you know, all things considered, Virginia is in a very good spot for that. But for those few who would take advantage of a religious exemption, I would just say that the sincerity and the validity of their religious convictions doesn't become lessened just because an emergency is declared. And so for them, it's every bit as serious during that time. And so really that's what we're hoping to protect, is the conscience of those individuals who, for whatever reason, really do have sincere religious objections. And considering how few take advantage of this, I don't think it would be a great public policy concern from a matter of health standpoint. So thank you for hearing us out.
Josh, let me ask you a question.
Sure.
So this whole COVID thing has been bad. But suppose it was a situation, suppose it was like smallpox. And I mean, don't we have to weigh, and I'm certainly attuned to these concerns, believe me. I mean, this is something you really have to struggle with philosophically. But at some point, don't we have to weigh the public at large's right to live and avoid death with a religious concern about a vaccine?
I think you are weighing it, and I think part of the consideration is that only a very few people would take advantage of this. And given the fact that children traditionally do very well in handling things with their immune system, children would be most likely to recover in those situations. But again, of course, you're right. Everything is a balance. But we think that the individual rights here on fundamental rights, we ought to, the tie ought to go to the fundamental liberty. So that's what I would have to say.
Okay, thank you. Next.
Chrisana Shackelford.
Thank you. Good afternoon, Chairman, members of the committee. I'm Dr. Chrisana Shackelford and currently represent the Virginians for Children's Health Defense here in Virginia. Just want to briefly just reiterate the support for the fellow speakers. Josh, thank you for tackling that one very difficult question too when it comes to the issue of the risks to the individual versus the population writ large. And I would just want to reiterate for the committee that where there is risk, there must be choice. And invariably, when we talk about vaccines and or specifically to the mRNA gene therapy, there is an individual risk. And when they include up to and including death, I think we need to make sure we account for that. But specifically, I just want to just reiterate that under Virginia Constitution, every citizen is equally entitled to free exercise of religion according to the dictates of their conscience. And I just want to make sure that we underscore this for the panel and just stress that even during an epidemic or even during a pandemic, it is critical that we maintain our religious freedoms. I'm just reminded recently from Justice Alito, where he worried about a future of religious liberty in the United States, and he lamented specifically, and I quote, it's fast becoming a disfavored right. So we need to make sure that we understand that even in an epidemic or even in a pandemic, that our religious freedoms are upheld. And I just have to go back and again underscore where there is risk, there must be choice. And invariably, when it comes to risk from a vaccine, or in the case of the mRNA, which is actually a gene therapy, and it is actually a synthetic therapy, I might add, if it includes risk to include death at the individual level, we need to take that into account. And in closing, thank you for bringing this bill to the fore. Thank you.
Yes, ma'am. Thank you, Doctor. Next.
Bonnie McLean, please go ahead.
Ms. McLean?
Bonnie McLean.
Okay, we have to move on.
All right, we'll try Jason Garwood again.
All right, can you guys hear me okay?
Oh, that's perfect. Yeah, great.
Okay, I'm going to leave my video off just in case. Just a couple of minutes of comments. Thank you. So good afternoon, everyone. My name is Dr. Jason Garwood. I'm the teaching pastor at Crossing Crown Church in Warrenton, Virginia. I've just released a book applying the biblical worldview to the issue of health, entitled Health for All of Life. And also a couple years ago, I preached a sermon on the issue of vaccines that went viral online, which makes me a unique individual to come and address you here today. As a theologian and an activist, I just have a short couple of things to say with regard to my support of SB 1116 and SB 1117. To start, I believe it's entirely shameful that we even have to have this conversation. Our religious rights, which come from God, the God whose image we all bear, are enshrined in, for example, the Virginia Statute of Religious Liberty and the United States Constitution. So the de facto position on everything is the assumption of religious freedom. It's the bedrock of our nation. The fact that elected officials are tenuously debating the importance of religious freedom when it comes to vaccination is, in my view, entirely abominable. If legislators care at all about honesty, integrity, the rule of law, then why wouldn't they have the courage to insist on religious liberty? My question is, why is this even a debate? Of course, religious freedom on this issue is true and right and good. And who is anyone to say otherwise? You, the civil magistrates, have a duty and a responsibility, as you know, to uphold and defend the rights that come from God. And this includes the right to decide what to put inside our bodies, which is, as the Bible says, the temple of the Lord. The Bible also tells us that we ought never to do evil so that good may come. And rest assured that hundreds of thousands of Virginians see the toxic sludge called a COVID-19 vaccine as doing evil so that ostensible good may come. And the Bible, of course, condemns this thinking. For example, all COVID-19 vaccines that use the spike protein from the HEK293 cells in their development are using aborted fetal cells in their vaccine. The Bible's position is that abortion is murder and morally reprehensible and therefore heinous in the sight of God. So the connection to vaccines is rather obvious. And finally, of course, politicians who grab for power and pragmatism for political expediency during a purported emergency, in my view, are shameful. Rights that I get from the triune God of the Bible do not magically go away because a bureaucrat says so. So threatening families across the Commonwealth with misdemeanors or worse for simply making a legitimate health decision or not is asinine. These bills, which would decriminalize refusing the vaccine and thus protect parental rights, must go forward to protect the right of medical choice and the right to exercise religious convictions according to and regarding health. So the Lord Jesus Christ, of course, is king. God will not be mocked. Jesus is Lord, not Caesar. And this means that magistrates are obligated to obey and render all things to him. And so the decision of religious freedom and whether or not to grant it is not yours to make. And so let's all do the right thing today. And I thank you for your time.
Thank you. How much time do we have?
45 seconds, sir.
All right, I'm going to give them a little extra time because we had a couple of technical issues with a couple of proponents. So let's put another minute and a half on the clock if you can do that. Okay, go ahead. Anybody else?
Bonnie McLean, would you like to try again?
Ms. McLean? Okay, next.
There are no more speakers, sir.
Okay. You want to, let's, well then.
Can I add one thing to the question you asked, Mr. Hetzler, please?
Sure, you've got some extra time. Go ahead.
Thank you, sir. There already is a provision within the school system that if an epidemic or an outbreak were to occur, people using exemptions would just be excluded from school at that point. And right now we have a beautiful virtual learning system and it's working really well for some people. Some people are opting for homeschool. So if we were to keep this religious exemption intact, even beyond, whatever external things going on, there would be options for these children. One of these bills speaks specifically to the school and parental rights. So it already says in the code that there's an option for that. So this would just be really continuing on with what our constitutional rights are. And like I said, and I'd really like to reiterate, it creates an equity and an equality across socioeconomic status for every Virginian to be able to make the choice of their faith and their religion. Thank you so much again.
Yes, ma'am. Thank you. All right, that's it for the proponents. Do we have people to speak against Senate Bill 1116 and 1117?
If those people could please digitally raise their hands, I'll get them in the queue. Lori Furlano, please start.
And again, 15 minutes, so judge your time accordingly. Yeah, Senator Sasslaw says total, not each. Go ahead.
Who's been brought? Have I been brought up?
Yes, sir.
Okay, thank you very much. It's listed on the video as Lori Forlano. I consider that an honor. She's my deputy commissioner for population health. However, my name is
yeah, Commissioner Oliver. I'm sorry, I didn't.
That's quite all right. My name is Dr. Norman Oliver. I'm the state health commissioner. I thank you, Senator Lewis, for this opportunity to present to the subcommittee. The administration is strongly opposed to both Senate Bill 116 and 17. Virginia really needs to maintain the ability to ensure a sufficient number of people are vaccinated to stop the spread of serious communicable diseases. Allowing a religious exemption to vaccination for an emerging disease could jeopardize the state's response, resulting in significant preventable disease and death, and could have serious consequences for society and for the economy. When a new pathogen, a virus or a bacteria emerges in the population has not been exposed to that in the past, and most people will not have natural immunity and will be susceptible to that virus or bacteria. If that pathogen can spread easily from person to person and has the potential to cause severe illness and death, it is critical to strive to develop a safe and effective vaccine as quickly as possible, and then to vaccinate as large a portion of the population as possible to make the spread of that disease from person to person unlikely. As has been mentioned, currently Virginia already allows religious exemption from routine vaccination for a child to attend school. And as also has been mentioned, the state health commissioner can exclude an unvaccinated child from the school if the disease is occurring and poses a risk. The intent of the law is to ensure herd immunity within the community. And as has been mentioned, right now, religious exemptions in Virginia are currently low at about 1.38%. This low rate is such that it has very little impact on herd immunity and therefore allows us to have protection from these communicable diseases. However, if this rate should increase and if it's left uncontrolled, an epidemic of one of these diseases, such as measles, could prompt the Board of Health to declare the need to restrict religious exemptions to ensure the vaccination rates rise back to the level needed to protect public health. We have not had measles epidemics in many, many years, and that's because of the widespread vaccination rate, the high vaccination rate for these diseases. Measles used to kill millions of people. That is not the case anymore. We strongly encourage that these bills not be passed.
Thank you, sir. Next up.
There are no more members of the public with their hands raised, Mr. Chair.
All right, so that ends the public comment portion. Any members of the subcommittee have any questions for Senator Peake or want to speak to both bills? Senator Donovan.
Thank you, Mr. Chairman. On the specific issue of parents being able to refuse or individuals being able to refuse, I would point you to the Patient's Bill of Rights, which is sacrosanct in medical practice. Our job is to inform, our job is to vet information and data and help patients make decisions and make sure patients understand the consequences of either side of the decision they make, but it is not to coerce them to get treatment. And in fact, number 4 in the protected right of patients is the right to refuse treatment. Now, the state may say your kid can't come to school, and the state may say there are restrictions upon you, but the state may not say that you will let me put this needle in your arm. And I think we need to pay close attention to that because we cannot mandate vaccines.
All right, thank you. Senator Dr. Donovan. Anybody else want to comment on the on either bill? All right, we operate by motion. I'm sorry, was the motion to report both bills? I guess we ought to take these up individually for record purposes. So do you want to make a motion on the low number and then on 116 or 1116? Okay. Senator Suderline. So there's a motion and a second that the subcommittee recommend reporting Senate Bill 1116. Call the roll.
Senator Saslow, Senator Barker, Senator Donovan, Senator Suderline? Senator Lewis?
No.
My apologies. Senator Saslaw, was that a yes or a no? No. Yes, sir. Thank you. 2 ayes, 3 noes.
All right, so the next motion would be Senator Donovan on 1117. And Senator Suderline, second. So the motion and second is that Senate Bill 1117 be recommended for reporting. Call the roll.
Senator Saslaw? Senator Barker? Senator Donovan? Senator Suderline? Senator Lewis?
No.
2 ayes, 3 noes.
All right, thank you, Senator Peake. I saw Senator Favola. Senator Favola, are you ready? You got a lot of bills, yeah. Actually, you know something? If you don't mind, Morrissey's only got one. Can we let him go? All right, Senator Morrissey, you've got 1427.
Thank you, Mr. Chair. Senate Bill 1427 is known as the Early Psychosis Intervention Advisory Board. The bill establishes a board, and the board is called the Coordinated Specialty Care Program Advisory Board. I'll say that again. The Coordinated Specialty Care Program Advisory Board. And it simply will assist DBHDS in expanding the provision of high-quality, evidence-based early psychosis and mood disorder detection. And currently in Virginia, there are 8 early psychosis intervention programs that are in operation. They've been operating since 2015. And these programs, as some of you may know, deal with those individuals between the ages of 16 and 25 who either have symptoms or some type of diagnosis or variation of a psychosis, a bipolar disorder, or schizophrenia. What this advisory board would do would simply make annual recommendations to the commissioner of DBHDS as to how to best manage and expand early psychosis intervention programs in the Commonwealth. It's a 9-member advisory board, and it's made up of individuals that specialize in early psychosis intervention. I won't go too much into the weeds, but if you want, I can, if the question arises, I can tell you with the various 9 members from what disciplines they come from. That's it, Mr. Chairman, and try to answer any questions if I can.
All right, thank you, Senator Morrissey. Any questions for Senator Morrissey on Senate Bill 1427? Okay, is there anyone signed up for public comment on 1427?
I believe there is, Mr. Chairman.
All right, great. Let's go ahead then.
Mindy Carlin, please go ahead.
Thank you, Mr. Chairman, members of the subcommittee. I'm Mindy Carlin. I am the Executive Director of the Virginia Association of Community-Based Providers. We represent those providers that are licensed by DBHDS that provide behavioral health and substance use disorder treatment services throughout Virginia. We support this legislation and urge you to vote yes. And we thank Senator Morrissey for bringing it forward. Thank you.
Thomas Schuplin.
Hi, I'm Tom Schuplin, and I've worked for over 35 years in the mental health field, and I helped start up 2 of these coordinated specialty care programs, one in Fairfax and one in Loudoun, and also a program for clinical high risk for psychosis. This is an evidence-based practice based on rigorous research that shows that anyone that participates for 2 years in these programs have reduced symptoms, better outcomes, they have better school performance, better work performance, better social performance, fewer hospitalizations, fewer incarcerations, and the need is very great. The 8 programs in Virginia, 4 of them are based in Northern Virginia. Most of the state is not covered by one of these programs, and the incidence rate for first episode psychosis is over 1,700 young people each year who have their first episode of psychosis. we can, at this point, these 8 programs are at full capacity, and they can only serve about 14% of the need in the state. So there's a great need to expand services and enhance the existing services. This board, which is composed of stakeholders and subject matter experts, can help the department do that by finding additional resources and helping these programs develop. So I support it.
Thank you.
Mr. Chair.
Senator Morrissey.
First of all, I thank Tom for his comments. I put the cart before the horse. I should have, and I will now move to adopt a substitute for SB 1427, which does exactly what I previously described. And the only difference between the earlier bill is that the substitute sends an annual report from the advisory board that I just described to the commissioner of DBHDS, and it also tightens up some language that the stakeholders fully agree with. So could I make that motion now?
Actually, you cannot, but Senator Barker has on your behalf, and Senator Sasselaw has seconded that. And so, all in favor, aye. So now the substitute's in front of us. Okay. Anybody else for public comment?
No, Mr. Chair.
Okay, great. Senator Donovan moves to report. Senator Barker seconds. Call the roll.
Senator Sasselaw? Senator Barker? Senator Donovan? Senator Suderline? Senator Lewis?
Aye.
5 ayes, noes 0.
Okay. Thank you, Senator Morrissey. Next up, we have Senator Favola for the balance of our docket. We call it the Favola docket. Senate Bill 1154. We'll do it, unless you have any objection, we'll take them just in numerical in the order they're on the docket. Is that okay? That's fine. Okay, 1154.
Mike, can I just speak?
There you go, you're on.
Okay, thank you, Mr. Chairman. 1154, this was actually heard by the parent committee, and we didn't have the language up on our tablet, so it was a little difficult to explain. Senator Donovan asked a very good question. I went back and met with David Knorr with the Department of Behavioral Health. What this bill does simply is what's already required to be reported by our state hospitals and by our licensed group homes when it has to do with either a serious injury or a serious incident, both of which are described in regulation. When something has to be reported to it's a human rights database authorized under 37.2-400. My bill merely ensures that the designated statutory advocacy group, which is the Virginia Disability Law Center, will have access to it. First thing. Second thing my bill does is, with allegations of abuse or neglect that are already required to be reported, once a determination has been made after the investigation, that determination would be also noted in the database. And that too is required as well. So this bill adds some clarity. It does not pick up the regulatory language because, frankly, providers would rather work towards a regulatory process. If there's going to be changes, they'd rather have the changes done in regulation and not in statute. So this merely codifies what the current practice is, but does not identify the specific regulations.
All right. Any questions for Senator Favola on 1154? No questions? All right. Senator Donovan moves to report. Is there a second?
Thank you, Senator Donovan. You actually helped improve this bill.
Yeah. She asks good questions and does good stuff. Is there a second to Senator Donovan's motion? All right, Senator Barker seconds, so the recommendation is to the full committee that 1154, I'm sorry. Oh, I'm sorry.
Oh, sorry to cut in. Senator Favola, I just wanted to make sure that you all adopt the actual substitute that she described.
Right. I was just thinking of that as soon as she moved it. Thank you so much, Anna.
Good catch. Good catch.
I was wondering, Mr. Chairman, may I ask your committee to please adopt the substitute I just described?
And Senator Barker has so moved, and so is Senator Saslaw, and so the substitute, without objection, is in front of us. And so now the motion, I assume the motion that Senator Donovan made that was seconded by Senator Barker applies to the substitute as well. And so that is that we recommend to the full committee reporting 1154 as the substitute for Senate Bill 1154. Call the roll.
Senator Saslaw, Senator Barker, Senator Donovan, Senator Suderline, Senator Lewis.
Aye.
Ayes 5, no 0.
All right, Senate Bill 1220, Senator Favola.
Thank you, Mr. Chairman. Okay, this bill is very simple. What it does is it merely repeals Section 37.2-827. So the repeal removes 2 paragraphs that actually were put in statute way back in 1950. The first paragraph actually is requiring a state mental health facility to ask the immigration status of a patient, and that has had a very chilling effect. As you know, as a country, we're suffering a lot of negative stigma associated with mental health. And in no other healthcare facility do we ask the immigration status. And the second paragraph actually gives ICE the authority to ask for any kind of record that may be associated with a patient if the clerk of the court has suggested that. And that, too, is not something we would do without due cause or without a warrant. This preceded HIPAA, and you really don't want any government agency to just have willy-nilly access to your mental health records. So that's what my bill does. I can give you, if you're concerned about whether or not a government agency could get access to your records under certain conditions, I can refer you to a code section. Oh dear. I think it's under the criminal code part of our, it's 53.1-219. So anybody who has been convicted of a felony, there would obviously ICE can get access to their records. And I'm not touching that section. That section is staying. I'm merely taking off the willy-nilly part. I do have a speaker who is just so anxious to speak. Amy Willard. I am.
Well, let me see if they've got any questions for you
sure.
first, and then we'll go to public comment.
Sure.
Any questions for Senator Favola on Senate Bill 1221? I'm sorry, 1220. Any questions? Okay, we'll go to public comment then. Who do you have? Somebody you want to go first, Senator Favola?
Thank you, Mr. Chairman. Amy Willard had asked to go first in the public comment lineup.
Sure. Ms. Willard?
Good afternoon, Mr. Chair, committee members. I'm Amy Willard, Director of Policy with the Legal Aid Justice Center. We support this bill. We thank Senator Favola for bringing it. There's a reason this bill is in this committee and not in any other. This is a very simple healthcare bill, and it's a bill to clear our code of an insidious history of discrimination. If someone's rushed into an emergency room having a heart attack, we do not stop to assess their immigration status and then report them to ICE. We do not mandate these actions in any other field of care, from ERs to our K-12 schools. We treat people as people because that's the duty and standard of care our medical professionals adhere to, and that is the policy our laws support. We should act no differently in the mental health context than we do in physical health. And that is also policy parity this General Assembly has been working to achieve now for years. All the current law serves to do is stoke existing fear and distrust, to create a chilling effect around one of the most serious areas of care needed, and not just within immigrant communities, but within non-white residents, regardless of immigration history or status. Now, especially now, we should be taking action to build trust between medical establishments and the people they serve. And we ask for the subcommittee's recommendation today. Thank you.
Okay, great. Everybody try and keep your comments to a minute or so if you could. Next.
Colleen Miller.
I think Colleen was on the earlier bill.
No, Senator Favola, you're introducing a lot of good bills.
Okay. Good to have you.
Good evening. It's Colleen Miller from the Disability Law Center of Virginia. And just briefly, we do support this bill. We think it's really important that there not be any kind of disincentive for somebody who is seeking mental health treatment. And if there's some sort of threat of being turned into law enforcement, to ICE or something like that, it absolutely will act as a disincentive to seeking appropriate mental health treatment, which will in many ways put society at even greater risk. So we do support this bill. Thank you.
Thank you. Next.
Chloe Edwards.
Good evening, Mr. Chair. My name is Chloe Edwards with Voices for Virginia's Children, and we are supportive of this bill. I also want to note that the Virginia Counselors Association is also supportive of this bill. Virginia operates 13 state mental health facilities for adults and children. Individuals can be voluntary or involuntarily committed to these facilities through civil proceedings on a temporary or long-term basis. But the facilities are distinctly not law enforcement, and their purpose is treatment. Mental health supports are critical to ensuring children are able to thrive and families can meet the challenges they face. According to Mental Health America, in September of 2020, of the youth 11 to age 17 that were screened for mental health conditions, 84% scored for moderate to severe anxiety, 90% scored for severe depression, and half reported that they have thoughts of suicide or self-harm. We know that children and families are experiencing a combination of symptoms related to the impact of the pandemic. Virginia should not create barriers to accessing mental health care, especially during this time. Please support Senate Bill 1220.
Okay, thank you. Next up.
Monica Sarmiento.
Good afternoon, Mr. Chairman, and good afternoon, members of the committee. My name is Monica Sarmiento, and I'm the Executive Director for the Virginia Coalition for Immigrant Rights. On behalf of our State Committee, we fully support this bill. Obviously, it should never be a stigma for anyone to go ahead and seek mental health counseling. And just to kind of give you an idea, so many first responders that right now have an immigrant status, but of course they're doctors, nurses, and because of this, they're unable to go ahead and get any additional help that they need. And of course, everybody should have that opportunity to get healthcare services if they need so. So we fully support this bill. Thank you.
All right, next.
Sarah Amry.
Thank you very much. My name is Sarah Omri. I'm a licensed professional counselor with Northern Virginia Family Service up in Falls Church, Virginia. And I work almost exclusively with the refugee and immigrant population. There's already tremendous stigma associated with mental illness and accessing mental health. We really don't want to add additional prohibitive barriers to help seeking. We want to be able to encourage uninhibited access to mental health services. So I and Northern Virginia support this bill.
Thank you.
Northern
Let
Virginia
me just say to the next speakers, there is absolutely no shame in saying you support the bill and in associating yourself with the other remarks. Okay? Don't feel like you have to restate everything again. All right? Go ahead.
Kenneth Gilliam, please go ahead.
Good evening, Mr. Chair, members of the subcommittee. My name is Kenneth Gilliam, and I serve as the policy director for New Virginia Majority. And we also strongly support the bill. And I'd like to align my comments with some of the other speakers, but most importantly, I want to add that the General Assembly, particularly as I think about 2020 legislative session, has taken significant steps to ensure that we're continuing to create of Virginia that works for all of us, and that also includes our immigrant neighbors. So strongly support the bill and also take additional steps to make sure that our immigrant neighbors, whether they're documented or undocumented or live in mixed status health homes, don't feel stigmatized for seeking health care that they need. So thank you all so much for your time today.
Okay, thank you. Next.
Ali Farouk.
Good evening. My name is Ali Farouk. I am the Policy Director for Families Forward Virginia. We are the Virginia chapter of Prevent Child Abuse America. And for the many reasons already stated, we support the bill.
Bless you. Thank you. Next.
Yeli Montano.
Hi, good afternoon, members of the subcommittee and chair. My name is Yeli Montano, and I'm with CASA Virginia. I'm here today to speak on behalf of this bill, as well as for our 10,000 members who fully support the bill and thank the senator for bringing it forward. As you heard already, the current statute serves no other purpose other than to perpetuate fear in our communities and deter them from accessing critical care. Immigrants face numerous mental health risks resulting from their migration process and from their experiences back home, such as community or political violence, abuse, or trauma, and they face unique barriers in accessing health services, especially mental health services, which puts them at a greater risk to poor health outcomes. We ask the subcommittee to help us in our efforts in addressing health inequities, but also in eliminating unnecessary and unjust barriers. Thank you so much for the time and the opportunity to speak.
Yes, ma'am. Next.
The last speaker in the queue is Bruce Cruiser.
Yes, good evening. Thank you, Mr. Chairman, members of the subcommittee. I'm Executive Director of Mental Health America of Virginia. And on behalf of our local affiliates and our organization, we support the bill for the reasons mentioned, because we really should be encouraging, not discouraging, children and adults from getting access to mental health care. Thank you.
Yes, sir. Thank you. Anybody else for public comment? We done?
Sir.
Okay. Any questions, or anybody want to speak, any on the subcommittee want to speak to the bill?
Mr. Chair.
Senator Barker.
These two paragraphs are older than I am, and I'm happy today to make the motion that we recommend reporting the bill and getting rid of these two paragraphs.
All right. And I'm up. Senator Donovan.
I will second that, but I would like to just comment on behalf of healthcare providers everywhere. That's what we do. We take care of people. And so I think I can only believe that this is an archaic language that was left over in the bill because it's been removed in the code, because it's been removed from everywhere else, because healthcare workers are absolutely committed to taking care of people. And that's what we do every day, and we shouldn't have to become part of law enforcement.
Yeah, great. Thank you, Senator Donovan. And Senator Donovan has seconded. So the motion is that we recommend reporting Senate Bill 1220. Call the roll.
Senator Saslow, Senator Barker, Senator Donovan, Senator Suderline. Yes, sir. Senator Lewis.
Aye.
4 ayes, abstentions 1.
All right, Senator Favola, the completion of the Favola docket with Senate Bill 1221.
Well, I really like your subcommittee, Mr. Chairman, so I'm happy to spend time with you. This is a very, it's a housekeeping bill. It's Senate Bill 2021. And what it does is it establishes Loudoun County in a position so it can be the contractor for the provision of public health services as opposed to an extension of the state. Fairfax and Arlington contract, those localities operate under a contract with the state, and they believe that the contractual arrangement gives the local supervisors and the local community much more control and ability to exercise accountability. The actual services are not going to change. It's just a difference in the administrative framework under which Loudoun operates. That's what they're asking for.
Any questions of Senator Favola on Senate Bill 1221? Or do we have any public comment?
We do, sir.
Oh, my. Okay.
Just
All
one
right.
person.
All right. Go ahead.
Jeff Gore, please go ahead.
Mr. Chairman, it's getting late in the day. I'll be brief. Representing Loudoun County,
Senator Favola was right. In the late 80s, Arlington got this authority. In the early 90s, Fairfax did. This will not cost the state a dime. It actually will cost Loudoun County some money because they're going to have to move everything over to be, all county employees, all county funded, whereas now it's just a county supplement. They'll continue to get the state subsidy like everyone else, but Loudoun will be on the hook for administering all these services in compliance with state and federal law. So the state won't really notice a difference, but Loudoun will have a little more flexibility and take on a little more responsibility at the same time. I'd appreciate the committee's support.
Yes, sir. Thank you. All right, the bill's in front of us. Motion, second. Moved and seconded that we recommend reporting Senate Bill 1221. Call the roll.
Senator Saslow, Senator Barker, Senator Donovan, Senator Suderline, Senator Lewis.
Aye.
Ayes 5, no 0.
I believe that completes our docket for today. Is that correct?
That is correct, sir.
All right, guys. Thank you for your work. We've got my bill, and I don't know if anything else is coming our way for next week. But for now, we are adjourned. Thanks.